So we have a patient on the phone whose husband was exposed to the coronavirus where he works. She is going to get tested and wants to know what you would like her to do if she tests positive.
She's going to get tested right now? Just everybody gather over here. Who's scared?
I'm scared for my kids.
Yeah.
I'm worried about my grandmother. But
She's like, mom, yeah.
Does anybody think that this virus is not in our county, even though we have no confirmed cases? Of course it's here. This is history. This is going to be the biggest event maybe in our lifetimes. The last time the world had to deal with something this big was World War II. Think about it. I'm going to work on what's happening in our area, so I'm going to be getting on the horn with the local health department officials. I think there's an epidemiologist that's heading this whole thing up in our area. I'm going to be getting on the phone with the hospitals, see what the plan is for them. Have they got, beds in place? Have they got enough ventilators? Is there a plan of action? Again, this is advice from doctors that I got up in Washington State. I think there's already a lot of this going. I just want to get the status of that so we all know what's going on, so we'll be able to let the patients know what's going on. Who is the person in charge of this response in our county, in Marion County? Is there one person?
That would be our health director. His name is Mark Lander, Lander.
Okay.
He's the health director of the entire health department. So he's always in charge. He's the number one guy. Epidemiology, though, which is led by Kelly Conklin. She is the supervisor of the epidemiology department, and she is an RN. And then I am the epidemiologist from Marion County.
Oh, okay. Wow, that's a lot of people. Excellent. Okay, and there's meetings about this. I assume this is a daily thing, isn't it?
Yeah. Oh, we meet almost the entire day. You just happened to get me in my office right at this very minute because
You're on your way to the next meeting, right?
Yeah, I'm pulling specimens that need to go to the Jacksonville lab for the high priority people that are inpatient in ICU right now. So we want to make sure that they go to Jacksonville and get tested tonight so that we have results. We want to truly make sure that we're freeing up the ICU and the negative airflow isolation rooms so that people that truly need them are going to be in them. And so we're taking those specimens directly up to Jacksonville to be tested because these are priority patients. If you go out to floridahealth.gov, they will tell you how many tests have been performed in each county and how many positive tests are in each county. So there isn't anybody that we're currently monitoring here in Marion County for, travel from China, travel from Iran, South Korea, or anything like that. So
Right.
we don't have anybody like that. Right now there's nothing in Marion County.
It's amazing to me that there's not a positive result. That implies that we haven't tested very many people yet, but I know we will
no,
be.
they've tested more than enough.
That's interesting. Okay, well, I appreciate your good work, and I'll talk to you. Thank you, Maggie.
Okay, give me just a moment. Let me find out. She said she's highly asthmatic. She doesn't really want to go to the ER and expose herself if she doesn't have it or expose other people if she does. Do you recommend she do anything else? Because she's called everywhere and nobody will test her.
Well, we're working on trying to find out who's doing it. This is exactly what we're working on today. So
Okay.
if we can get her number, I'll give her a call back a little later on this afternoon.
All right.
I probably need until about 3:30 before I have a better answer as to where she might be able to go. Just stay isolated for now.
Okay.
So there was a place that I heard that is doing it. Let's find out. Just holding. What? It went to a message. How do I put this on speaker?
Speaker?
Oh, I thought that was volume.
This is volume.
I can't get anybody to answer the damn phone anywhere in this whole building. This is not going well.
Because all their phone calls go straight to a call center. They don't go directly to the office. So she ended up giving me the supervisor of the call center. She said what they're doing is they're not testing everybody. They're doing televisits, and if the doctors feel that they need to come
Sure.
get tested, then they're telling them what location to go to get tested.
Are they testing at all locations?
Certain ones, but they will only tell them. She wouldn't tell me, but they have your number, and she said if one of the providers or the office manager is not busy, that they will call back to speak to you.
According to President Trump, Walmart, Walgreens, Target, and CVS are doing drive-through testing. We
Thank
need
you.
call Walgreens, Walmart, CVS, and Target. Speak to either the manager or the pharmacist and ask them if they know anything about testing and if they have any idea how long before we do testing in Ocala. This should be good. Oh, alcohol? Sorry. You want the whole box?
No, I just want one for my phone because
Yeah.
I touched it to check for
Oh.
warfarin.
That's a good idea. I'm gonna clean my phone too. Thank you for
Okay.
reminding me. You got to keep it clean. What's happening with the phones, did you say?
Everyone's just calling for like information. What is our protocol? How are we handling it? How are we seeing patients? Are we closed? Are we going to remain open?
Okay.
If we are going to remain open, when do we decide to close, or what do we?
We're open all the way through.
Yeah, it's just
no
a
matter
whole
what.
bunch of
I mean, we're open all the
different-
way through, unless we all get the virus, which we're not.
We are not.
That's the point of
We're
this.
not.
So, are they responding okay to what you're giving them? They're okay for
Yeah,
these visits out there?
Yeah, I mean, the fact that we could substitute it with curbside or phone calls,
Yeah.
they rather that than not be seen at all. So
Okay,
The
all
patient
right.
I just spoke to, she said the same. She's like, I really don't want to get out of my car. And I was like, well, if need be, if you do decide that you do need to be seen or
Yep.
whatever, we are doing curbside. Just either call ahead or knock on the door, let us know we're coming out, we'll check you out. She did say that her sister has been experiencing symptoms.
Local?
Yes.
She's local?
However, she doesn't know where to go with the testing, and she was going to call and see if we're doing it. I did inform her that right now we do not have the proper PPE for
Yeah.
doing so, but
Yeah.
we are in contact trying to make moves to find out who is
I may be able to get those
offering.
I may be able to get those N95s, but I want to see if somebody else is doing it first.
Right.
Yeah.
So I just said hospital. If I would call the hospital and see
Yeah, that's what I'm about to do
if
next.
that's the case. If she's desperate and it gets bad enough, by all
Right.
means, go to the hospital. They have
Okay, I need to get the
vendors.
hospitals on. Yeah, I need to get the hospitals on the phone then.
At a date, time, and place not yet decided, the Monroe Hospital District, Ocala Regional Medical Center / Ocala Health, which includes the West Marion campus, and Advent Health Ocala are working collaboratively on establishing a central point in the county for drive-through sample collection.
Okay.
Okay?
That's in the works.
That is in the works.
Okay.
Okay?
I think it's
I can't tell you whether it's going to happen today, tomorrow, or the following day.
Sure.
But I know that there are meetings going on with the CEOs of all three of those entities. The HCA company, the Advent Health company, and the county. We also put a 20 by 40 tent that's being erected today at our Timber Ridge location. So that the people on the other side of the county don't have to drive downtown just to get their swab.
Well, how many beds are at Advent?
425, and I'm having a 40 by 60 tent erected. We'll be putting up a field hospital.
Oh, wow. That's beautiful.
It should be, it'll hold a lot more than 100 patients, but I'm having air conditioning, electricity. Yes, sir, I've got 31 negative pressure rooms, not including my ORs. ACA has put out guidance in 5 or 6 different ways that a standard room can be converted during this pandemic, converted into an acceptable negative pressure room. And my engineering staff has determined which one of those 5 or 6 options is best for our building. So I think I can take care of 100 people here easily with, or more,
Right.
with COVID-19.
You know, there isn't a positive in our county yet, which is amazing to me. I can't believe it, although I feel like we probably haven't done that many tests yet in our county. That's the impression I'm getting, although...
Yeah, it's only a matter of time.
Yeah, I agree. Thank you. Bye. 31 negative pressure rooms. 400 beds. They're building a tent. Yeah, they're doing good work at Advent. Yes, ma'am.
Mayor, I got a hold of somebody, they
Yeah.
said that the office manager is busy, I said, well, what about a physician?
And
And they're
anyway.
gonna have a nurse call you in 10 minutes.
Perfect. Will you update me on Walgreens, Walmart, CVS, and Target, please?
There is nothing happening at any of them. They received a generic email, but they do not know if they're gonna be a designated pharmacy
any
of
of them?
choice, any of
Okay,
them.
so nobody is doing testing.
Not currently.
Not Walgreens, not Walmart, not CVS, not Target.
Generic email was sent and that was it.
And they don't even know if their locations are going to be one of the ones that are selected
Chosen, correct.
by somebody at corporate or whatever. So we're just wait and see.
That's it.
So that's no help to us at this point.
Absolutely correct.
And no timelines
No
whatsoever.
timelines. Just a generic.
Okay.
Maybe chosen.
Thank you.
You're very welcome.
Jeez. This is what the test kit looks like. The mystical, magical test kits that we've been talking so much about. So one of these is Quest and one of these is LabCorp. I'll hold this up here. See those? Just swabs, that's all it is. So you left the mayor a message.
I did.
What time was that one?
It was at, please hold, 2:24 p.m.
You left the mayor a message at 2:24.
I did.
All right.
Asking him to call you. I spoke to Michelle, the triage nurse at Advent.
Yeah, what's happening over at Advent?
They are not testing
Yes.
unless the person has traveled outside of
Right.
Florida, outside of the U.S.,
So there's
or if somebody near them has tested actually positive for the virus.
Yeah.
That's the only way they're testing.
but yet nobody in our area has tested positive, so probably nobody around here would.
ORMC, the facility, the entire Ocala Regional has decided not to test at all.
Stop it.
Unless they are an inpatient already and they have reason to believe that they need to be tested.
So no ER in and out
No,
stuff.
they're sending them to the CDC website, they're giving them the 800 number for the health department, that's what they are doing. And I even confirmed that with the Mary Camp little sub-ER,
You're right, yeah.
same.
Okay.
Okay,
Wow, ORMC. Nothing in the ER.
nothing.
That's very good to know. Thank you. So give me an update on how this was for you guys. How many did we see? Triage nurse,
Yes.
Yeah,
Jordan's scribing with Chris.
like I'm asking.
scribing with her,
You know,
and you're documenting what's
Everything.
being scribed.
yeah, she's like documenting all of that.
That's
too.
good. Is
So
it?
it's
Is
just
that
like
okay?
it's
Is that?
much
Is that?
faster like that?
It
Yeah.
went better than like this morning, we were all.
Because this morning we were all outside and
Okay.
we were all like
Okay.
back and forth.
Okay.
But it's much better like that. I think tomorrow would be
Yes.
better like that.
When Kent said Dr. Kuhn needed to speak with him.
Oh yeah, that's the mayor. Is there a discussion, at least at this point, about any, closures in town? Are we staying completely open?
Well, I know that the Sandra Wilson, our interim city manager, had a long list of, I'll be glad to forward you the emails about things that are closing. Pretty much everything we've had as far as event-wise is canceled.
Right.
We're just deciding, do we open the customer service office? Utility bills are going to be waived, over the next 30 days. Like I said, there's bags over the parking meters downtown.
If there's any advice or guidance or anything that you would like to say, to the community, I am happy to receive that and get that out to people.
Okay. We're having a council meeting tomorrow night.
Okay.
So I know that there's going to be a lot of discussion about things we're going to do, not do, and we'll have some kind of final, direction on where we're going. I would encourage people, if they feel comfortable in going out and doing business with folks, do it. Take all your precautions, like you said, that, you need to.
Yes.
And if you're sick, stay home.
Is there a lot of anxiety about this? Does everybody get the feel?
One extreme or the other.
Yeah, mascara wants to know if you're gonna give it to
Polar opposite.
It's either, this is baloney, this is nothing, or I'm scared I'm gonna die, I'm scared I have it. Like that kind of thing. Yeah, it's extremes. Yeah, what's happening on the phones?
Phones are crazy. I had like 6 people call wanting to know where they can get tested. One lady started crying because she couldn't find anywhere to get tested.
Hopefully we'll have a better answer. We got a lot of people on the phone today. We got a lot of good information, but there's still a lot more that we need to know so we can have much better advice to give the patients. Everybody has work. Everybody's gonna have their kids cared for, and we're gonna protect ourselves and each other and our family through the whole thing. Yeah? Okay. See everybody in the AM.